If you're over 60 and have fallen or have a fear of falling, then this video is for you. Research has identified 4 key factors related to your foot that are correlated with falling. In this video, I'll explain to you what those are and how you can improve your stability to decrease your fall risk. Now, the study examined 187 individuals aged 62 to 90, and they looked at a bunch of different factors related to their foot structure and function. Then they used statistical analyses to find out which ones were most correlated with falls. And those were decreased strength in the calf muscles, decreased range of motion in big toe extension, more pressure on the inside of the foot, and increased center of pressure velocity in the forefoot. Now that fourth one is kind of difficult to understand, but basically that means your center of gravity moves around more on your foot, i.e. you're more wobbly. Now I've seen other videos that have referenced this study, and they focus primarily on the first 2 factors, the calf strength and the great toe extension, and proposed as a solution strengthening the calves and doing stretches to increase big toe range of motion. But one thing you need to understand about research is that correlation does not imply causation. What that means is just because your calves are weak and just because your big toe is stiff, fixing those things doesn't necessarily decrease your fall risk. So we have to look a little bit deeper. And you can boil all 4 of the findings in the study down to one key thing, and that's an improper gait pattern. When you walk normally, you're supposed to push off your big toe using your calves, and that creates both big toe extension as well as strengthens your calves. And it's most likely that lack of doing that on a regular basis is what caused the calf weakness and what caused the loss of range of motion rather than the other way around. Now, when you push off your calves, it causes the propulsion to bend your knee and swing your leg through so that you don't drag your toe and trip over your foot. Now, the other 2 factors, pressure on the inside of the foot, has more to do with excessive pronation when you're walking. And when you pronate, that means flattening your foot. Now, you're supposed to normally flatten your foot as you load weight out over the foot. That helps with shock absorption. But then when you go to push off, your foot has to come back the other direction into supination. And that makes your foot a rigid lever so that you can push off of it. And if you stay in pronation too long, then you don't have the ability to push off using your calves and extend your great toe. Now, furthermore, when you pronate, that makes your foot a little bit more wobbly. It's not as stable, and so that causes the increased wobbling around. And so the best way to improve your stability over your foot when you're walking is to focus on walking with a correct gait pattern. So rather than doing exercises to strengthen your calves and improve your strength, if you consistently focus on your walking pattern when you're walking, that'll help improve all 4 of those factors. So what that would look like is hitting a little more on the outer side of your foot when you're walking. That puts your foot in a slightly more supinated position. Then you are supposed to pronate as you're loading weight over your foot. It's supposed to flatten down a little bit, but not excessively and not for too long. So you want to hit a little more over the outside of the foot, flatten down slightly, and then pressure off of your big toe. So as you're doing that, you'll hit on the outside, slowly control the pronation down, push off the big toe using your calves. That extends your big toe. And then as you're coming down on the next foot, you hit on the outer side of that foot. Control the pronation down, press off the big toe using your calves, and then swing through. And that helps you to clear your foot as you're walking so you don't trip over your toes. Now, some people just want an exercise to do. And if you're one of those people who absolutely must have an exercise, here's one to do. Instead of doing just regular calf raises like this, when you're pushing off, you're actually kind of driving forwards using your glutes and your calves at the same time. So if you stand up against a wall, kind of like you're doing a calf stretch, and then propel up and into the wall, so you're using your glutes and calves at the same time, that both strengthens your calves as well as creates more big toe extension when you're going forwards rather than when you're going straight up doing a regular toe raise. Furthermore, when you're doing the heel raise, you want to think about keeping your Achilles going straight up. You don't want to allow it to pronate in that way. And that helps with the third factor, the excessive pressure on the forefoot. So again, to show that exercise, face towards the wall, go into a calf stretch, come up and forwards into the wall, using your calves and extending through the big toe. Now, another limitation with that study is that it only looked at factors related to the foot, as if there were no other things that affect your balance. And you have to look further up the chain than just the foot, because there are likely other factors that are contributing to those findings in the foot. And one big factor is your hip. If your hip is weak, that causes wobbliness over your foot and increased pronation. So another good exercise to focus on is standing with your foot slightly domed so that your arch is lifted, and then practicing balancing on one leg by squeezing your glutes. Try to stay as still as possible as you're doing this, and this helps increase your balance over your foot so you're not flattening down excessively and you're not excessively wobbly over your foot. Now, if you want to go a layer deeper than that to find the root cause, you also have to look up at the back, because the lower back is what innervates your calf muscles, the muscles that prevent pronation of your foot, and your glute muscles. So if you have a lower back problem, particularly a lower back problem affecting the L4, L5, or S1 nerves, that can also give you some balance and walking problems. And one big cause of that, especially in older adults, is spinal stenosis. Now, if you'd like to check out videos about how spinal stenosis causes balance and walking problems and what to do about it, check out these videos over here. But before you go check those out, if you found this one helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.